Can any medications interfere with ASV therapy? Have you ever wondered if the medications you take could affect your adaptive servo-ventilation therapy? This is an important question, especially for those dealing with heart failure and sleep apnea. Certain medications can indeed interfere with the effectiveness of adaptive servo-ventilation therapy. Medications that impact the central nervous system's control over breathing are particularly concerning. For instance, opioids are known to create complex breathing patterns. These patterns can include irregular or ataxic breathing, which may not respond well to adaptive servo-ventilation therapy. If someone is using opioids over a long period, adaptive servo-ventilation might help with breathing but often does not fully correct the abnormal patterns or low oxygen levels. Other medications, like baclofen and valproic acid, also affect gamma-aminobutyric acid pathways. These drugs can worsen central sleep apnea by acting on the neurons responsible for breathing. This can complicate how well adaptive servo-ventilation therapy works. Ticagrelor, an antiplatelet medication, is another drug that can increase the drive to breathe and potentially lead to central sleep apnea. This interaction can further complicate the outcomes of adaptive servo-ventilation therapy. The way medications interact with adaptive servo-ventilation can vary based on the underlying cause of sleep apnea, whether it is related to heart failure or the effects of the medication itself. In patients with heart failure who also have sleep apnea, adaptive servo-ventilation is often used to treat central sleep apnea and Cheyne-Stokes respiration. These patterns are generally more predictable and may respond better to adaptive servo-ventilation. However, when medications like opioids are involved, the irregular breathing patterns they cause can reduce the effectiveness of adaptive servo-ventilation therapy. Managing these interactions is essential. A thorough evaluation of a patient's medication regimen is necessary when considering adaptive servo-ventilation therapy. Identifying medications that may worsen central sleep apnea is key. If possible, discontinuing or adjusting these medications can lead to better outcomes with adaptive servo-ventilation. When changing medications is not an option, it may be necessary to tailor the settings of adaptive servo-ventilation carefully. In some cases, supplemental oxygen might be needed to manage low oxygen levels. In summary, various medications can interfere with adaptive servo-ventilation therapy by altering how the central nervous system controls breathing. Opioids and medications that act on gamma-aminobutyric acid pathways are particularly notable. Managing these interactions is vital for optimizing the effectiveness of adaptive servo-ventilation therapy, especially in patients with heart failure or complex sleep-disordered breathing patterns influenced by medication use.